Welcome back, everybody. Have you heard of a bariatrician? Do you know what that means? Well, Dr. Julie Swindler does. She is a bariatrician. She's here to explain this is a semi-new field of medicine, or a specialty in medicine, and it has to do with basically keeping all of us in better shape so we live longer, healthier lives, right?
Well, they're absolutely. You know, a lot of people have heard the word bariatrics and automatically say, oh, they have the stomach stapling. Right?
Laparoscopic type stuff, right? Is that what they call that?
Exactly. Well, they have the lap band,
right,
the bypass and stuff. You know, and it's because bariatric surgeons do the bariatric surgery, but bariatricians do the non-surgical aspects. So it's whether people are thinking about having surgery, they've already had surgery, but actually most of my patients have no desire at all to have surgery. They just are coming in there saying, I need to lose this weight and I don't know how to do it, and I want it to be nice and safe and healthy. And some of them don't have any other medical conditions besides they're just overweight or obese, and other people have all kinds of them. They're diabetic, they have high cholesterol, hyperlipidemia, high blood pressure, different things like that. And so we work with them one-on-one in an individual comprehensive program. And you're right, it is a relatively newer field. It's rapidly expanding, which is also a little scary too, because some people are trying to practice the field of bariatrics without having the proper training. And then the public doesn't know where they should actually go. Right.
And this is a field you're telling me that, you know, there are a lot of different reasons, obviously, people are coming in with you know, a weight issue, and you can treat it in a variety of ways, from behavioral to with medicine and various other things, or a combination of all those treatments to get them individually to where they need to be.
Absolutely. I mean, almost always it is, like you said, a combination. You have to, everybody of course has to do nutritional changes and exercise components, but it's individual for everybody. You cannot just pick one diet and say, okay, this is what everybody's doing. It won't work that way, because everybody has different needs and their bodies react to food differently. So it has to be based off of them. There has to be psychological changes, metabolic and biochemical things that we look at in the lab work to make sure that we're not missing something that maybe a different physician just hasn't gone and looked for, because there was no need to previously. And of course behavioral aspects as well too. So you have to do that and combine it all into one program. And when they do that, people do great. I mean, over at Medical Bariatrics at Lexington, we've been open in the Lexington area here for over 2 years now. And by using our electronic medical record, we know 97.8% of folks that come to see us lose significantly medical weight. And we're happy to say now 8 out of 10 decrease their lifelong risk of diabetes by more than 50%. So
there you go.
That's great news.
Fantastic. And she is now one of, you're on a new board. Tell me quickly about this honor. So, I mean, she knows what she's talking about.
We've been very blessed and fortunate enough to be asked to be on the American Board of Bariatric Physicians. So that's on the national level. There's only 7 people in the U.S. that get to do that. And I'll be lucky enough to join that elite little crew. So we'll be working on always revamping the guidelines for bariatrics and working to bring the best weight loss medicine to Lexington and to all around the surrounding areas.
Good deal. Dr. Swindler, thank you. Good to see you. 859-263-SLIM. Check it out. She's trying to get me as a client. She probably should, but that's a personal question. I don't talk to my doctor on the air with y'all, just her when she's gone. When we come back, Mary, our doctor of weather, she has a big degree for that. She knows what she's talking about. It's going to be nice. She'll tell you next.